Hi, today I'd like to share about aminoglycoside, and instead of talking about the mechanism and etc., there's lots of pharmacology videos and books you can have a look. So instead, I will talk about more to the perspective of clinical use and what you should be aware of, and the different types of these antibiotics. As usual, I like to start with a case. So we have an old man being treated for Staphylococcus endocarditis for 4 weeks, and he made a good recovery. However, and this one day, he suddenly complained of unsteady on his feet, means he cannot maintain a good balance while standing. So what happened, and what is the cause? Since I've mentioned about his being treated for endocarditis, so you have to think about what is the drug, the antibiotics we've been using. But since this is the name of this video, so you may know I'm talking about aminoglycoside. Uh, so what I would like to mention, what I want you to learn from this case, that you must remember, there are many side effects of aminoglycosis, and that's one of the reason why this antibiotics is it's not like you don't use it like commonly. You can use it like a monotherapy for uncomplicated infections like uncomplicated urinary tract infection. But if there's like a spreading out like a systemic infection, you seldom use this alone. Usually you either combine this with other antibiotics or you just use it alone monotherapy for uncomplicated infection. Since there are lots of side effects you have to consider in this antibiotic, so you have to use this in conscious and like be careful. And that's why I share a case with a common side with a well-known side effect, ototoxicity. So one of the side effects, this ototoxicity means it's damaging the inner ear cellular part of the inner ear. Um, how and why does it affect the balance of the patient? So as you know, the inner ear, including the cochlear and vestibular structure, they all in charge of hearing and then to maintain balance respectively. And in this case, the patient is having vestibular dysfunctions here. So we can see the inner ear is here, this part, and since the aminoglycosides is uptake into the inner ear, it is damaging the vestibulo-ocular reflex and the vestibulo-spinal reflex. And these reflex are all in charge for the balance of the body. And we can see I circle here, and this part is the three semicircular canals. So they all in charge for the balance of your body. So if you are interested, you can you can check it on some anatomy book, but I'm not gonna go through it that far in this video. Anyway, so here I have a list for the adverse effect and the contraindications of these antibiotics. And this another well-known adverse effect is nephrotoxicity, which is causing damage to your kidney. But there's nothing perfect in this world, right? So you may have a patient have a have already have a renal dysfunction, but at the same time is having an infection that you have no choice, have to use aminoglycoside. So it is always a difficult decision. So it's all depends on the situation. So you have to be conscious if there's any patient show up and have renal dysfunction. You have to balance of the pros and cons, whether you should use this antibiotic or not, but it all depends in the scene. Anyway, so the second one's like I just talked about ototoxicity and vestibular toxicity, and this teratogenicity, which means you're not gonna give it to someone who's pregnant because it may damage the fetus or the baby. And then so another adverse effect is neuromuscular blockage. So that's why you don't use it on potassium. And then if the patient have a problem of myasthenia gravis, if you look up on some gram-negative bacteria, many books or websites, they will give you other options, and this is also correct. So this is why I add a severe gram-negative. So because there are many adverse reactions and you have to use it in conscious. So you can treat this antibiotic like your joker card, like that's you will decide it only while you encounter severe infection or in some special case, and I will talk about it later. But anyway, this antibiotics is not those drug you use it like at once or immediately you use this card. You have to think about it and use it with cautions. And then anyway, I have some example here for the gram-negative infections here, the E. coli, the Klebsiella. So they are all the common pathogens for urinary tract infections. And also this is also for the Pseudomonas aeruginosa. And this one is quite serious infection. So this one is almost, you can think about aminoglycoside already if you see this infection. But anyway, as like I mentioned before, it all depends. So make sure you think about it before you give it to a patient. And other than using it in a monotherapy, just like I mentioned before, you can also give it with beta-lactam antibiotics such as penicillin to against some gram-positive bacteria. And this is synergistically means 1 + 1 is larger than 2 in this case. I think you must understand what I'm talking about. So, and then how it works is the beta-lactam antibiotics, they inhibit the bacterial wall synthesis, so it helps facilitate the aminoglycosides to enter the cytoplasm and target on the 30S ribosomal subunit and disrupt the protein synthesis by the ribosome of that bacteria and then to kill the bacteria. And what you also have to memorize that this aminoglycoside is not for anaerobics. What is anaerobics? N means no, aerobics means need oxygen. So these bacteria doesn't require oxygen to survive. But aminoglycosides, they require oxygen to be absorbed by the cells. So in this case, this antibiotics is not gonna work for anaerobics. And then also, aminoglycoside is not absorbed by guts. So you give it parenterally, like intravenous, but we still have 2 exceptions. You're not giving them IV, and I'll talk about it here since I mentioned it. So these 2 drugs, this one, Tobramycin, they are not given intravenously, but it gives in a nebulized form, which means there's a special machine mix it with the it's like you give them for those asthma, and then you let the patient to breathe in the medicine, and then when are you gonna prescribe it is when there is a pulmonary Pseudomonas aeruginosa infection, but not in ordinary patients, but in those patients with cystic fibrosis. And in this case, you can give this one for the in a nebulizer spray and for the patient. And the second one is neomycin. Is that this is too toxic to give IV, so you may kill the patient. So please remember, never ever prescribe neomycin intravenously. You may kill the patient. And then so instead you give them orally. So what is the purpose of this one? So it helps. It is for the gut clearance, and in hepatic encephalopathy. So back to the first one. I think everyone must recognize this one. This is a very common aminoglycoside. The gentamicin is like a common choice, and then in other case, like such as you, like I mentioned before, you can combine with penicillin for the staphylococcus and endocarditis. So in the opening case I share with you, the patient is properly having this combination, but unfortunately he got the adverse event. So anyway, for this antibiotics, if you see there's an uncomplicated urinary tract infection, you can only think about giving this to patient. But still, we try to avoid to use this not that much, because we are afraid of this resistance to gentamicin. But if unfortunately there is, you can give amikacin for a patient. And then the third one, streptomicin, is like a very well-known TB drug. So yep, and this is the common aminoglycoside you may encounter. And here I have some of prescripting instructions. So you may pause here to read them and to go through them, or you may have a screenshot. Anyway, this is a quick sum up of how you of the prescription. But there are many instructions. Will tell you have to have a close measurement of the serum concentration on gentamicin after the prescription. But this is not although you have a monitoring, but this is not a guarantee for you to relieve from the patient is not gonna have adverse effect. They are still gonna have the nephrotoxicity. So this is the point of monitoring, right? So even though the concentration might be in the safe range, but still the patient is at risk. So always be careful and remind yourself there's high risk of the nephrotoxicity, and then monitor like the urine output and the other symptoms properly related to the renal injury. And yeah, and there's some interaction you also have to be aware of. So neomycin, if the patient is already on warfarin, so this neomycin will reduce the vitamin K absorption by disrupt the intestinal flora. If you still remember, I talked about it few slides before. This is the only one you're given by PO. Orally, and that's for the gut clearance. So this is why this medication, this specific drug can reduce the vitamin K absorption, and that's why affect the effects of warfarin. And you don't want to see warfarin get like being disrupted, so you have to be very careful. And the second one is gonna be affected is digestion, also by neomycin. And then in this case, it's gonna reduce the absorption of digestion. I try to find what is the mechanism, but there's not very like a common agree on this one. So just memorize this one. And the other interaction, this is for most of the aminoglycosides, is don't mix them with neuromuscular blocking drugs, just like I mentioned about the contraindication in the previous slide, that because there is a neuromuscular blockage effect of these antibiotics, so you don't use them for those disease and also the drugs that's causing neuromuscular blocking, like here, like I mentioned before. And then do not use this antibiotic with other drugs that also increase the risk of nephrotoxicity. And I have a list here. Yeah. And then if unfortunately the patient have like is greatly affected by the nephrotoxicity, is probably gonna have an acute tubular necrosis. So what you will see, you will probably see a non-alloretic AKI. That means the urine output is kind of still normal. I'll say like it looks normal, but actually there's acute kidney injury happening under the table. Just you don't know it, so it's quite sneaky, but it's gonna happen 5 to 10 days after exposure to these antibiotics. So there's a typo here. Anyway, so you have to be aware not to use them together, and that they have a high risk. And these drugs alone already associated with a risk of acute tubular necrosis, so avoid them. And this is the end of this sharing. I hope it helps, and thank you so much for your time.